Welcome back, everyone. Whether you're looking to say bye-bye to unsightly varicose veins or any vascular complications, Atlanta Vascular and Vein Center is where you need to make an appointment. Here to explain is Vascular and Interventional Radiologist, Dr. Amish Tilara. Welcome, doctor. Thank you for being here.
Well, thank you for having me here.
Of course. So just doing the research on you and your background, Harvard University for residency, Emory for your fellowship. What made you choose outpatient clinics rather than staying at just a big academic center?
So academic centers taught me a great deal, but I also realized that I couldn't really fix some of the problems that are associated with healthcare these days, and mainly being patients that don't have easy accessibility to get into office visits, long wait times for procedures, and also high costs that are associated with the hospital systems as well, which ultimately falls on the patient. So that's why I joined Atlanta Vascular and Vein Center, because in this situation, we try to provide world-class care without any additional cost to the patients. We want to give patients appointments within 24 hours.
Wonderful.
We also try to get emergency procedures the same day, and we're available for our patients 24 hours a day, 7 days a week.
Terrific. And something I really wasn't aware of, I know you do many minimally invasive procedures for women, including treatment of uterine fibroids and, of course, varicose veins. But let's talk about fibroids. I didn't even know that that is something a vascular surgeon or doctor does.
Yeah, so actually, uterine fibroids are a very interesting condition. And actually what they are, they're benign tumors that occur in the uterus. They affect as many as 3 out of 4 women throughout their lifetime.
Yes.
Now, the thing is, many women go undiagnosed with this condition for a variety of reasons. One is because they just don't see a doctor, they live with the symptoms. The other is actually because sometimes these fibroids don't cause any problems at all.
Right.
Now, the most common symptoms associated with these fibroids are actually heavy periods, painful periods, pelvic pain and bloating, and actually they can cause things like increased urinary frequency as well.
And then what are the treatments for this condition? What do you do?
So that's very interesting. So medical science and technology has advanced so much. So in the past, because these fibroids can occur in a lot of different locations, what happened is they did a major surgery called an hysterectomy. If you look at the picture on the left-hand side of the screen, you can kind of see the different locations of those fibroids and how it could be technically difficult to kind of get to them.
Right.
So with a major surgery, there's a lot of complications that can happen, not to mention scars and prolonged recovery. So medical technology is advanced, and there's a new procedure called uterine fibroid embolization, which is what I'm an expert of. Now, what we do is we just use a tiny needle stick to basically get into an artery, either in the wrist or in the groin. We work our way all the way up to those blood vessels that are supplying those fibroids. So these fibroids are abnormal tissue. They're very rich in their blood supply. So we put these little beads inside of that blood supply to clog up that tissue and basically take away the oxygen and nutrition, which causes these fibroids to shrink away. The problem gets solved, and actually you preserve the normal uterine tissue. And it's a procedure that's shown to be very efficacious and is actually covered by insurance.
Wow, it's really incredible. I bet a lot of women out there didn't even know that that was an option for the fibroids. So what are ways that viewers can actually learn more about this procedure and about your expertise with handling them?
So I agree with you completely. I think the knowledge is really not out there in the community. And I really want patients to be empowered and to have knowledge. So I'm actually usually offer educational seminars. I'm actually going to offer my next one on January 28th, which will be just on uterine fibroid treatment. So all the viewers are invited to attend. Okay,
so make sure you call the number on your screen, 678-878-4555. If you'd like to learn more about this, if fibroids are an issue with you, this sounds like a procedure. And we talk about, I mean, I've read stories and studies of, what they're saying about hysterectomies these days and how, the prevalence of them and are they really necessary? And then what women have to go through as they're recovering from them. So to think that there's more of a non-invasive option, it's incredible.
And patients actually go home the same day after the procedure's over as well. And recovery time is days versus months.
Right. So. Wow, phenomenal. And then let's talk quickly about varicose veins. Obviously, it's your Atlanta Vascular and Vein Center.
Of course.
So, not only are they unsightly, but they're painful. They can cause so many different problems. So talk to me about why they are harmful.
Okay, so you made a very, very important point, which is a lot of people have a misconception about varicose veins. They think that it's just unsightly. They think it just doesn't look good, but they can actually lead to a lot of problems and complications. Leading to things like skin discoloration, pain, swelling, as you mentioned, even to frank ulceration.
Ooh.
So it's important for people to realize these things and to make sure that they get treated for them when they need to. Now,
and what are some of those treatments? They've come a long way, again, getting back to technology, right?
Absolutely. So if you look at the diagrams, first we'll kind of explain what happens in varicose veins and why these veins become abnormal. So when you talk about blood flow from the legs, if you look at the right-hand picture, blood is supposed to go in one direction, from your legs up into your heart so it can get recirculated and reoxygenated in your lungs. And the way that happens is we have one-way valves in these veins. when these valves don't work properly, blood goes in the wrong direction. So if you look on the left-hand side of the screen, you can see blood not going through that diseased valve in the wrong direction, which actually causes these veins to get a lot bigger, increases the pressure, and causes all these varicose and spider veins to occur. Now, it's important that when we talk about treatment of these varicose veins, we really go on to see, individualize these treatments for each patient.
Right.
Because you have to see what's underlying, what the inside problem is to treat the outside problem. Because just as we're all different on the outside, we're also different on the inside.
Exactly.
So
Not
really
a cookie-cutter treatment.
Exactly. So it really takes a thorough evaluation with an ultrasound to see where the problems are at hand and then focus the treatment based on that.
And recovery time, is that, again, have we improved with technology? I imagine so, that the downtime isn't as often, or as long, I should say.
Oh, sure. So as far as like the treatments go, all the treatments that we do, the recovery time is instantaneous. And then treatments range from things like sclerotherapy all the way to lasers. And now there's different lasers out in the market. It's important for people to know that whatever laser they use, make sure you do research on it. We use the laser that's most up to date, has the highest efficacy rate for vein closures, and has the lowest side effect profile. And again, recovery time is immediate. We actually encourage patients to walk the same day right after the procedure.
Incredible, doctor. Thank you so much. It's been a pleasure meeting you and having you on the show. And I know you have a great offer for our viewers. Tell us more.
So all the viewers that are watching the show right now can actually get a free vein screening. They just have to call up our phone number and let them know they're from Atlanta & Company. We'll be happy to see them for initial consultation. Fantastic.
Free vein screening. And don't forget, as you were telling everyone, about the seminar coming up to talk more about how to get rid of those fibroids. And where are you located?
We're located in Lawrenceville right now, 600 Professional Drive, Suite 160.
Thank you so much.
Thank you.
If you would like to contact Atlanta Vascular and Vein Center, give them a call right now. Sign up for that seminar, 678-878-4555, or log on to atlantavascularcenter.com. And this segment was paid for by Atlanta Vascular and Vein Center.